you very much for coming to listen about the role of omega-3. Let me share my view about how omega-3 works and how I think it's important. I just have to make a disclaimer that I work for the company called Reckitt Kaiser. We also have some dietary supplements. Therefore, this disclaimer is to say whatever I present here is just my personal point of view based on my knowledge, but not the company's view. So I'm going to go and explain the content of my presentation, but before that, I would like to hear from you. How many of you think that omega-3s are beneficial? Oh, almost all of them. So that makes it very easy for me to make my case because I'm one of them who really likes omega-3s. So I'm going to talk a little bit about the biochemistry of omega-3 and how they act in the cell membranes, and a little bit about the digestion and absorption. And also then I'm going to go and talk about the benefits and negative and positive clinical evidence we have so far. And then I'll go a little bit into the mechanisms and functions in very top line. And then I'll go a little bit to the history of omega-3 and talk about deficiencies and why deficiency matters, followed by what I think that there are gaps in omega-3 knowledge and how to fill them. Finally, I will share my opinion on the future of omega-3s. So, just to start with the omega-3 biochemistry, just before I go into omega-3s, it's important to understand that the fundamental difference between the saturated and unsaturated fatty acids. Of course, omega-3s are one of the polyunsaturated fatty acids. The fundamental difference between the saturated and unsaturated fatty acids are if they are in the cell membrane or anywhere in the body, the saturated fatty acids tend to stay straight, but unsaturated fatty acids, because of the double bond, they tend to have a kink on their molecular structure. This is really important when it comes to the cell membrane. Why it is important is because saturated fatty acids, they tend to pack very closely. They tend to pack in as a very rigid membrane, whereas unsaturated fatty acids, because of this kinked nature, they packed very lightly, and this allows these membrane proteins and other stuff to attach easily, to maintain the diversity, and making a good platform for many different reactions that happens through the cell membrane. So the cell membrane dynamics, the reactions, the platforms are very important for all living cells. Therefore, having a good combination of saturated, unsaturated, and all these types of fatty acids are very important than just having one or two or three types of fatty acids in your cell membrane. And talking a little bit about the omega-3 digestion, when you intake the fish or the dietary supplements, what happens first is it emulsifies with belly salts, and in case of some fatty acids, like for example phospholipid omega-3s, you really don't need this process. It can just go into the next one and digest by the lipase enzymes, and then form the structure called chylomicron, get into the lymphatic system and to the bloodstream and to the cells. And inside the cells, there are a lot of things happening, and depending on the saturated, unsaturated nature, it determines the nature of the cell membrane, and it decides the functionality of the whole cell membrane. So now, thankful to Dr. Bill Harris and Dr. Von Sharkey, they have come up a few years ago and proposed a way to measure that how many molecules of EPA and DHA are actually present in cell membrane. In other words, if you consume fish oil or fish or whatever the omega-3 fatty acids, you can really measure your omega-3 intake results. Omega-3 index is the name for that test, and omega-3 index is simply the sum of EPA plus DHA in your red blood cell membrane as a total percentage compared to other fatty acids. This is really important, and this actually tells where your consumed omega-3s actually ends up in your body. So, talking about the benefits, there are multiple benefits. Some of them are perceived benefits, some of them are direct benefits, some of them are indirect benefits. And, like when you talk about omega-3s, it's very hard to name a place in the body that omega-3 doesn't work. But it's not the case with clinical studies. You don't really have a lot of clinical studies for all these areas. And some of these are benefits as results of some primary benefits. So we just have to go by the clinical studies, and I'm going to briefly summarize some of the clinical evidence and also some of the negative clinical evidence. So the very first thing comes to our mind is the heart health or the cardiovascular benefits of omega-3s. And if you take the literature, more than 60% of the literature is on heart health of the omega-3s. So the very first very prominent evidence is on the reduction of triglyceride. But keep in mind that triglyceride benefits are on high doses, at least 850, I would say, EPA plus DHA, and it takes a little long time, about 1 year. And also it matters what kind of patients we are looking at. Patients who have higher triglyceride levels, they have greater reductions. And of course, inflammation resolution is one of the fundamental biochemical mechanisms of omega-3s. And also, omega-3s are known to reduce the sudden cardiac death and reduce the arrhythmia. And also have some benefits on atherosclerosis and also anti-thrombotic effect. And omega-3s are known to reduce blood pressure, but not a lot, very slightly. In other words, you can't use this as a blood pressure reduction medicine, but it helps a little bit. And also supports the endothelial function. I didn't say negative here, but I said not positive. This means moving forward, the studies have been done, and they have reported no effects. So that's why I said not positive. Of course, omega-3 does not reduce LDL. Actually, at the doses we use, all the way from 250 milligrams to 3 grams, they slightly increase LDL. It's not so dangerous given the good benefits of omega-3s, but it's the nature of, at least this is what's been reported in most of the studies, slight elevation of LDL. And also they are not helping with the arterial fibrillation. Just to, I don't want you to read about this or very serious about it. All it tells is that the effect of omega-3 on heart health, like any other dietary supplement, is time and dose dependent. One of the good examples is that in order to reduce triglyceride, it takes about an year to see the results. And if you want to fix arrhythmia, it takes place in about 3 weeks. So there is a diversity into this. So if I talk about the brain and cognition, brain and the retina of our eye are the two locations in our body where we have highest DHA omega-3 concentrations. So this actually tells how important for normal function of the brain. DHAs are key important molecules in your brain. In other words, in order for your brain to function properly, omega-3 DHAs are very, very important. So going to talk about the clinical benefits that we know. It's been shown to improve the cognition of older adults, and also in case of Alzheimer's disease, it reduces the risk of developing Alzheimer's disease, and also it reduces the dementia, and the deficiency has been associated with dementia. And also there is some support for ADHD, but the children between 7 and 13. That's where at least the clinical data are kind of spreaded through. And like not so positive effects, no support regarding cognition in healthy elderly individuals or young or adults or children. And also after you get the Alzheimer's disease, there is no support. At least, there's no data in the literature. So about the eye, again, in the previous slide I told you that the highest DHA omega-3 content of the eye is found in retina. The retina has rod and cone cells that are sensitive to light. These areas of the cells are packed with DHAs. So now for light sensitivity, you see how important omega-3s are. And tying that back to the clinical evidence, omega-3s are known to have benefits on macular degeneration, cataracts, which is one of the most common eye health condition, disease condition. And also it helps with dry eye. This is mainly because of the membrane properties, and also have some support on diabetic retinopathy and glaucoma. So the benefits on bones and joints, not in osteoarthritis, but in rheumatoid arthritis conditions, you know that the bones, or actually the joints, get really inflamed. So there are a lot of inflammatory molecules being secreted into the joints, and these joints get swelled and inflamed. Omega-3 has been known to reduce the inflammation in these joints and have some beneficial clinical outcomes, such as reduce the morning stiffness and joint pain in rheumatoid arthritis patients. And also, going beyond, they've been known to reduce the requirement of NSAID drugs. And interestingly, omega-3 has been known to help increase the bone mineral density in the hip in both men and women. And one thing to note that is that there are a lot of literature about omega-3s, and they help with arthritis, but mainly it's rheumatoid arthritis, not osteoarthritis. And the very popular supplements like glucosamine, chondroitin, and even in combinations, we don't have really good data. So just to summarize a few other important areas of benefits and not so positive benefits. With children, there is some support for asthma and some support for depression and prematurity. Also, the new literature is coming that the sports drinks and how it helps neuromuscular functions and all this, but their new literature need a lot of work. But not so positive ones when it comes to asthma. No significant supports for adults, and no support on multiple sclerosis, autism, or diabetic retinopathy. And these are not so positive effects. The reason for me to list them is that because of the confusion, people tend to investigate this and verify, okay, there are no benefits, at least as of now. So it's not that uniformly all good effects of omega-3s. There are some negative results. And New England Journal of Medicine, one of the prestigious journals, like very high impact factor, they published and concluded that no benefits from omega-3s. And 2 years ago, in late 2013, study came and published their data that omega-3 is known to increase the prostate cancer. Actually, I read these negative data, negative reports with more interest than positive reports. It's because part of my job is to defend that. Not only that, but they're very interesting. You can actually find something that's not aligned with the current body of literature. At least there are fundamental disagreement between at least the way they present the data or they extrapolate the data. So my conclusion about all these negative press, all these negative data, I truly believe scientists are very holistic about their data. That's true. I'm not suspecting them that they are manipulating the data or anything. That's true. I believe their data. But I think they should very carefully extrapolate this data. When they explain this data, just present the data. Don't jump into conclusions, and just present your data and be honest about data. Some of these publications, I don't want to pick one, but most of these publications, they present data. Actually, they are not the primary outcomes of these studies. For example, there are studies they conduct with a different primary outcome in their mind. In a clinical study, when you have a primary outcome that you design your experiment to get the result, you focus on that primary outcome, not the secondary outcome. So when you get some data on the side that are, for example, negative data on omega-3s, then you should set that as the primary outcome, verify that data with a properly designed clinical study. And going to explain this or generalize this data into a very blurry, putting you in a blurry situation is not good. So the overall idea here is that to date, the negative data are not strong enough to eliminate all the positive benefits of omega-3s. That's at least my conclusion. So with all these negative data, omega-3s, they continue to have a good market, good interest. Let's look at the functions, and these are the responsible factors, at least for omega-3s, great future or the present. So for the simplicity of explanation, I will divide the functions or the mechanisms into four. The very first thing I would like to talk about is the cell membrane functions, which I explained a little earlier. And omega-3s, when they are in cell membranes, they contribute to membrane composition, actually the diversity, fluidity, and deformability. And by accommodating membrane proteins, they play a big role in cellular communications. And talking a little bit about the energy metabolism, and actually they are known to participate in endocannabinoid reactions, actually modulate them, that helps with food intake. And anti-inflammatory activities, though omega-3s mostly impart their benefits through anti-inflammatory mechanisms, Omega-3s are dietary supplements, and in US at least, we are not allowed to make any disease claims. That's why we are not talking inflammation at all when it comes to the claims of omega-3s. So, but in theory, omega-3s produce prostaglandin E3, and it competes with COX enzymes that competes with omega-6s to produce PGE2, which is very highly inflammatory. So producing PGE3 is more beneficial than harmful PGE2, which I explain little details later. And also, omega-3s are known to produce inflammation resolving molecules like resolvins and protectins. And also, it's not new, but there are strong evidence that omega-3s modulate gene transcription. There are a lot of important genes, and they are affected by, in a good way, with omega-3s. So you remember I talked about the saturated and unsaturated, how membrane holds a lot of membrane proteins, and that allows proper communication and all these benefits. There I only talked about the saturated and unsaturated. When you talk about unsaturated, there are monounsaturated and polyunsaturated. And when you talk about polyunsaturated, also there are good polyunsaturated fatty acids and bad polyunsaturated fatty acids. For example, omega-6 is not a so good polyunsaturated fatty acid, whereas omega-3 is a good one. So just to talk a little bit details about omega-3s and omega-6s, as you see here, omega-6s, they work on the same COX-1, COX-2 and produce PGE2, which is very highly inflammatory. And at the same time, when omega-3s are there, they produce PGE3 with the help of COX-1 and 2. Now you see, with omega-6, they compete for this. It's a competitive inhibition and production of more safer PGE3. On top of that, when the omega-3 is EPA, it produces resolvin, and with EPA and DHA, they produces resolvins and protectins. You know, protectins are very well known neuroprotective molecules as well. So there are a lot of benefits to omega-3s. And now we kind of understand, and we realize the importance of having more omega-3, at least having a good balance of omega-3 in your body, in your cell membrane, for better health benefits. So I know it's boring, but let me read this. Several sources of information has suggested that human beings evolved on a diet that had a ratio of omega-6 to omega-3 fatty acids of about 1:1, whereas today Western diet has a ratio of 10:1, 20, 25:1, indicating that Western diets are different in omega-3 fatty acid compared with the diet on which human evolved, and their genetic patterns were established. So how do we know this, like what our ancestors ate and all this? Yeah, of course, we have to believe what the scientist says, what the time they spend. They actually did a pretty good job. The same scientists, this is just to reiterate what I just read about. So the same scientist proposed and actually published this article in 2004. Let's have a look. As you see here, until 100 years ago, we were consuming very less trans fats, and all of a sudden we increase our trans fat. And omega-3s, omega-6, until about 150, 100 years ago, we consume about the same omega-3s and omega-6s. But now, all of a sudden, we have increased omega-6s, decreased omega-3s. Same for saturated. Since about 200 years, we have increased the consumption of saturated fatty acids, and also same for total fats. So what this tells is that for thousands of years, we've been evolved in an environment, or we've been evolved on a diet where we had less fat, and actually we had a good balance, good composition in our diet compared to the diet we eat today. So how at least I see about this is that just because of this, compared to our genetic makeup, now we are in a deficient situation. Actually, this deficiency is not very good for our body, just because we've been evolved on a diet where we had 1-to-1 ratio. Now the diet is about 1-to-20, and this incompatibility, along with many other incompatibilities, can cause a lot of problems, and that will explain a lot of problems. This is not just for omega-3s, but it's true for many other supplements. So this compatibility really matters. Now let me explain what is this incompatibility, why I think it's important, and how I think it's important. But I'll be very short and sweet. So too much science, let's talk about cars and engines. Okay, so imagine this luxury car, and it looks nice. It looks like it has good performance thanks to its engine. But most of these good cars today are built for premium gas. What happens is we keep filling them with regular gas, because why you think like I spend a lot of money to buy this good car, and it's no point. It has a strong engine. It's not going to be sensitive for this small change in the octane level, and okay, just let me feed with regular gas. The car is new, the engine is strong, and it doesn't feel any difference very soon. But the days, weeks, months, years pass by. It starts to give problems one by one. Check engine light comes, and there's some miss. All these things happen. Finally, you will end up in a unpleasant situation. Same. When we are young, we think like Supermans. Okay, let me eat the pizza and burgers all day long, no problem. Our body can handle, this amazing body can handle a lot of things, but when we are young and strong enough. This body, like I explained, was evolved like the engine, 1-to-1 omega-3, omega-6 ratio. But now, we feed the body with 1-to-20 or even more. And so it's no surprise that we might end up getting a lot of health issues. So, now, if I ask the question that I told in this slide, it's been a very short time we changed this, right? It's just 200 years compared to thousands of years. We are Homo sapiens. We are 200,000 years old. So when you compare the time, at least 200,000 years, with this 200 years, it's nothing in evolutionary terms. So what if we go back? What if we eat the diet, or if we get omega-3s, omega-6 into 1-to-1 ratio? Do you think we have any data? Actually, yes. Okay, so there are multiple data points, papers I can refer this. But these data are in its infancy. these these studies need more focus. These studies need more sample size. The time factor should be very carefully considered. So yes, indeed, there are data and lot of data that when you feed the old diet, the diet our ancestors were in, we resolve these problems at least up to some extent. But the data are based on short-term studies, so they are promising. We need more carefully designed longer-term clinical studies to confirm this. The other thing is we need to pick the correct population, because if you take someone who eats meat for junk food for the entire life, he needs more omega-3 in his system compared to a person who takes 2 fatty fish meals per week and just following good heart health recommendations. So we need to pick the right population, and also we need to pick the right dose and right timing. And if we do this right, if we get the data, we have a good case to make. So just my last slide, I'm trying to predict the future of omega-3, but you have to do me a favor. I was trying my best to find an angry fish, because I was going to tell that fish are going to get killed for another good years to come. But I don't know whether it's a happy fish or angry fish. Anyway, until we prove this incompatibility or the deficiency is not true, fish oil, fish supplements, fish meals will have a good future, and the fishermen will have a good time. That means unless we prove that omega-3s are not really required for your body, that's redundant, omega-3s will continue to grow, and that will have a great future. So with that, I will let you ask if you have any question.
We have a question back here and one up in the front.
I would like you to expand on the publication that came in 2013. Can you give, what was the reason for being not saying the negatives about there's no impact on omega-3?
Which one? The New England Journal of Medicine?
Yes.
Yeah. Actually, to be honest, that's why I said the data is really good. And also the population size, it's about almost 10,000 people. The study is good, but it does not justify all the effects. The cardiovascular outcomes they measure is not on the normal population. For example, if you get this car analogy, and if the patients are really, really sick, so the engine is almost gone, now you feed omega-3s, it's not going to really help, because the patients are in a stage where they need to be taken care of by their physicians. These dietary supplements, they are not for curing diseases. So when you are in a stage where you need to get immediate medical attention, giving supplements, they are actually not meant to do that. That's one of the disadvantages.
One more question,
Thanks for the presentation. I have a question is, how do you think about the source of the omega-3, from the plant or from the animal? So any difference between that? Or the most important thing maybe is the dosage of the EP and DHA.
Okay.
Right?
According to the current literature, both dose, I will answer your second question first. Both dose and the form of omega-3 is important. For example, EFSA recommends at least 250 EPA plus DHA for better cardiovascular health.
Then what's the percentage of the purity? For example, 30% or 50%?
30% is normal fish oil in the market today, but there are high concentrated fish oil available up to 85%.
85%.
Yeah, but you need to keep in mind that most of these high concentrated fish oils are not in the triglyceride form. In today's market, we have three different types of fish oil, in other words, omega-3s. One, ethyl ester form. That's what you get with high concentrated Lovesa type of ethyl ester form. Is the most concentrated one. The next one is regular fish oil, which is like 18 to 12, 30% type of fish oil. That's triglyceride form. And the krill oil comes, the concentration is low, but they are in the phospholipid form. So the phospholipid form has the advantage in terms of absorption, and the ethyl ester form has the also have an advantage because they are very highly concentrated.
Okay, so
And to answer your
plant or animal, which one is good?
what?
Which one you think is better for the absorption?
Animal, plant, to answer that question, most of the plant omega-3s are ALAs. They are not efficiently converted into EPA and DHA in the body compared to when you take EPA and DHA directly from animal sources.
One more question.
Thank you.
Just a couple of comments if you want to wrap up probably,
Yeah.
but we're in the middle of this. So one of the problems with omega-3 fatty acids is understanding that the competition for the phospholipases and then the subsequent metabolism to either eicosanoids from the arachidonic acid or the other products involves this sort of preference of phospholipases for omega-6. They would much rather release omega-6 than omega-3. So for omega-3 to be effective, you've got to load up the membranes and force them to choose omega-3 fatty acids.
Very true.
So what we've got to do in sort of dietary interventions is not only think about the amount of omega-3s we're putting out there, and you do need a lot to force the competition.
True.
And the second thing is, what is the background intake of omega-6s? Because there's a lot of products that said, take some omega-3s, take some omega-6s. You're defeating the purpose in that context. And I still have issues with the argument that the future is linked to that sort of primordial competition where grows evolutionarily through omega-3 dominant diet, because I'm not sure that is as accurate as perhaps you make out. Partly because you've already explained that the plant-based ALA type mechanisms are very difficult to convert. And so I don't think all of the human population was running around eating fish and calamari or whatever you were getting your omega-3s from.
Correct.
So I think it's a little different, but I think the biggest problem in having an intervention for omega-3s for dietary interventions on a societal level is the fact that we're coming across a constant force of negativity in the media in certain healthcare provider groups that seem to be very dismissive, partly because I think of its nutritional source. We had another big Wall Street Journal, Washington Post article last week, which had no new data, but reiterated, well, my opinion is it's lousy.
Yeah.
That's the challenge.
Yeah, very true. Let me tell you a little bit about the prostate cancer paper came in. Like I said, that study was not designed to study the prostate cancer outcome of omega-3 supplementation. That was designed for something else. So you just cherry-picked some data out of it and explained the negative data. You get a lot of media attention. whether you say it right or not. Data is data. Yes, you can cherry pick the data and explain that data in the way you like, but you have to think about the whole big picture of it. And when you design an experiment to look something, and when you just focus on a secondary, tertiary outcome and take on, that's not fair. So, but that's unfortunately what's happening now.
All right, we're going to wrap up this session. We're going to go on our break for 20 minutes, and before we do that, we're going to do the certificates.
Take about 15 minutes coffee break.